Now, there's another kidney issue that will take out some time and look at what it is and how it could actually affect people that have it. So we're looking at the medullary sponge kidney. So this is how we could say that a kidney is actually medullary sponge. It's looking like a sponge. It has a lot of pores, looking like a sponge that we use to bath. So it's a rare but it's a congenital disorder of the kidney, and it's characterized by what? A lot of cysts in the collecting ducts of your kidney, the medulla and the papillae. So it's often discovered just like that, And okay, so pathophysiology is congenital form of what? Renal medullary collecting duct. Okay, so dilated ducts and they form clusters of what? Small cysts in the papillae. So this leads to what? Stasis of urine. There's like blockage in the flow of urine. So this over time could lead to kidney stones, okay, and also infections. So it's usually bilateral, like two of your kidneys are affected. Okay. So clinical features, some patients will have it and no symptoms. That's why I would say that most of the times it's discovered incidentally. Okay. But when it keeps becoming worse after some time, that's after a very long, the person is born with it. So after a very long time, it keeps becoming worse. You now see blood in urine, you now see a lot of pain in the flanks, infections are now more frequent. It could lead to stones, kidney stones. Now, if you do an imaging, this is an imaging, right? You see something like what? A paintbrush or a bucket of flowers. It's like a bunch of flower, you know. CT urography, you can also do ultrasound. Complications could lead to kidney stones, could lead to the person having frequent infections, blood in urine. Okay, the rest of it. So there's no cure, but make sure you take a lot of fluid and take food that have low sodium and oxalate, and for medications, potassium citrate to reduce the risks of stones coming up. And they can be giving you antibiotics for the meantime just to reduce the risks of infections coming up.